services being taken away. Talk to me about what you know about that situation right now.
So first of all, we love to hear the feedback from our veterans. We serve veterans, and if we're not hearing from our stakeholders, then we're missing the point. And we're hearing from veterans. We've talked to our veterans, talked to our stakeholders, congressional staff, our employees about changes which are occurring within Eastern Kansas. And so them being here allows us to see the passion that they have. And my own staff and leadership have a passion of serving veterans. And we look at several things: quality, cost, patient satisfaction, and access. And that is important for an organization. Changes occur continually. And so as we look towards our strategic direction and action for Eastern Kansas, there are some tough decisions that we've made that looks over all of those 4 areas so that we can be good stewards of the funds that are coming to us from our taxpayer dollars, but still maintaining the access. And so that's what we're doing. And we hear from our veterans and know that these changes may be a little unsettling, but it doesn't take away the care that we provide to our veterans. And actually, we're expanding it. We're looking at expanding some of our clinical services of oncology, of audiology, use of community care. That's a great benefit that our own Senator Moran has really taken a big part of expanding care to our rural veterans here in Kansas. And so that's exciting. But I think the biggest issue was maybe losing services within an ED. And that's not the case. We may become an urgent care center rather than an ED, but it's providing those same services that we actually are already providing. Not as much emergency care as one would think that would trauma like here at Topeka. It doesn't come to us anyway. We use the community. And so really what we provide care in our emergency department right now is urgent care procedures and urgent care related. As we looked over access, we looked over cost, we looked over quality, there was a time from late in the evening until early in the morning where we did not have very many veterans coming to see us. And it was a decision that I'm recommending, as it's a higher level of approval that needs to be given before this changes from an emergency department to an urgent care center. But we're following those data points and feedback from our veterans to be able to make the right decisions for our organization.
And if you could can you summarize exactly for, veterans watching, for community members watching who might be confused about what's going to change, what isn't? Can you tell them what will be different, when that's going to happen, and exactly why you guys made those decisions?
Sure, absolutely. So the recommendation is for our emergency department to become an urgent care center. Emergency department is available 24 hours a day, 7 days a week. The urgent care center would be open from around 8 in the morning until about 8 at night. If those who come at 8 and they're still here, we're going to provide that service until they don't need that, whether they're admitted or discharged back home. So it'll be a little bit longer than that, but it's for a 12-hour period, and that's during the weekdays. The weekends, maybe about an 8 to 9 hour day. But again, many of the veterans who are coming in, it's an urgent care type of a need, not a emergency. Now we do get some who have a heart attack, and if it's through an ambulance where they come, we ask them to go to the nearest ED, because we don't handle that type of intensive service here, and we would work with the community if a veteran came in to be able to get them to the highest quality care that they need to be having. And so that we would be doing that anyway, even today. And so what that really does is we've looked at some of the data points over the past 3 or 4 years, and we would have an average of 1 to 2 veterans come in from 8 at night until 8 in the morning. And we still have to make sure we have all the services available for that 1 or 2 veteran. That 1 or 2 veteran makes a difference, absolutely. And so we're working ways within our staff to be able to make sure that we have that proper handoff to the community, that if it's a behavioral health need, that we have that service still provided within our current staff that we have. But that could mean that we would decrease some of the positions that we have over those late hours, and is really focuses on that cost point, right? Without losing quality. And so that's really what we're looking at. That's a service that could change, and I'm not the final approval authority. That has to go up through my region and VISN, and then up to national for final approval. And we're still working on the proposal to go forward, so we're looking out definitely not probably later part of this year, the earliest, maybe even into next year.
And as for the why, I know you kind of touched on it on, you know, different points, maybe not as many veterans in those early morning hours, also cost, but also expanding other services for those veterans who still might be upset about not having, you know, those full hours for whatever reason. I mean, what do you want to say to them?
So we have a budget that's provided to us through Congress, and that's our taxpayer dollars. And it's my responsibility as the director CEO to be a good stewards of those funds. And I think veterans and other leaders of other organizations go through this every single day. And so I want to be good stewards of those taxpayer dollars that you, our veterans, family members here in Topeka provide. And so with that, we need to look at what we can do to be able to maximize those dollars. And if as we move forward to make some of these changes, if we can utilize those dollars that are maybe not being as efficiently used, we can expand other services. Like I said, oncological care, audiology, eye. We're recently have hired an ophthalmologist to be able to do cataract surgeries here. We're working through that. So we're looking at ways to be able to expand services in areas that we definitely do need, and others that maybe are not as efficient. How do we minimize that, expand access to our veteran? But I want to just again make sure that everyone knows that here at Comrie O'Neill VA Medical Center in eastern Kansas, across many counties, we are still here for our veterans. We're not going anywhere. We are expanding things that make sense for the needs of our veterans. We're working with the community care and making sure our veterans who are a little further away still receive that care. And so we're here, and we're going to be continuing to be here for quite a while.
Great. I think that was the last message, but I want to turn it over to you if you have any, you know, last message that you want to send out to people watching.
Well, I think for our veterans, I love the passion that you have, and our family members of veterans, in taking care and wanting us to take care of the needs of our veterans. I'll tell you one thing that I'm very, very much satisfied is that we have a greater than 90% trust level with you, our veterans. That's a high level. It's not 100%, it's not 99%, so we have some opportunities to improve that. And that's why we engage. We have advisory groups of veterans that I hear from. I walk around my 2 hospitals and talk with veterans in the hallways of what we can do better. As I go out to different communities and talk with veterans, I hear that feedback that you do great things, but you can do this thing to improve. But that trust level really shows the satisfaction that our veterans have for the care that we provide here in Topeka at the Comrie O'Neill VA Medical Center is high. And they want to continue with it, and so do I. We're going to do all we can to continue to do that.
Great. And I just have one last question too. How many veterans do you guys serve?
So across Eastern Kansas healthcare system, we see over 40,000 veterans. Again, within our 2 hospitals, our 8 clinics, and also collaboration and seamless care within the community. So great number. Would love to see more veterans. So if you haven't been receiving care here at VA Eastern Kansas, come to us. Let us provide that care, because that will then help us provide more care. Because when we can seek additional funds through VISN, our region, and up to national, because of the more veterans that we're seeing. So if you haven't signed up to receive care at VA Eastern Kansas here in Comrie O'Neill, come and receive care.
Here's your message right now to do so. And hopefully that Washburn partnership, I did a story on.
You saw that, yeah.
Yeah, hopefully that'll, you know, bring more student veterans too, which would be awesome.
That vital program with Washburn is wonderful. We have a great thing with an Atlas program, which is out in Emporia, which allows us to do virtual health, telehealth, for those veterans who are there,
Mhm.
they get to receive the same services without coming up here. And we're doing that across our whole 27 counties that we have, 37 counties that we have in Eastern Kansas.
That's amazing. Did you guys do that pre-pandemic? This is just my curiosity. Pre-pandemic or because of the pandemic?
So we've done some telehealth and virtual health
Yeah.
for a number of years, even
Mhm.
before pandemic, but it definitely
Yeah.
escalated in tremendous amount, and our staff are excited to do that. We know it can't be always done continually for every service, but it works well for many services, and we're going to continue to do that.
Definitely. Well, thank you so much, sir.
Thank you.
Appreciate it. I've
Appreciate
seen that
it.
firsthand because my sister's a nurse, so she does all